Hi, I'm going to tell a story about perseverance in the face of adversity. I'm a former labor and delivery nurse of about 14 years experience in the field. Labor and delivery is a very unpredictable area of medicine. I worked on a 28-bed unit. We had beds for laboring patients. We had a triage area, patients that were sent in from the doctor's office for further evaluation. We had a high-risk OB area where patients that were having complications with their pregnancies were at, and then we had the operating rooms. We did have a schedule of induction of labor, and we had a surgical schedule, which did kind of help us control to a point, the amount of patients that would be called into the department. But you never knew what patients were going to come in the door unexpectedly and what their issues were going to be when they came in. This particular day started out as any other. We had our induction of labor patients in the building, and we had our surgical patients either in the building or on their way. Very quickly after that, though, as we would say, the floodgates opened up, and before you knew it, all 28 beds were filled, and there were actually people laboring in the waiting room. We didn't like for this to happen because it was unsafe situation, but it did because we could never close our doors. We did our best to take care of the patients as they came in and move them around, making room for the ones that were waiting. Part of our job was to take call. We would have to work our scheduled shift and then be on call different shifts throughout the month to help out. I was actually on call for the 3 o'clock shift that day, which means more than likely I'd be working 16 hours. I was already exhausted from my first 8 hours because it was non-stop, no break, taking care of people as they came in. Not only was I going to have to work from 3 to 11, but I would have to be in charge. I was the senior nurse there, and so that would be my role. Charge nurse is responsible for making assignments, for problem solving, for working with the doctors and the anesthesiologists, and just really kind of trying to keep some kind of control. It was going to be very difficult that night because I was short nurses. We did our best to make the assignment as equal and safe as we could, and I was actually going to take patients that night to help out. About halfway through the shift, things continued to really kind of stay as bad as they were. It was just a very busy night, and my patient started to have severe complications. She needed an emergency C-section. Usually there's 2 nurses that go into the operating room. One will scrub, and they'll be sterile, and they'll be the ones that are handing the instruments to the doctor, and then the other one is there for, we call it a circulating nurse. They would be the one writing things down and running to get whatever else was needed for either the doctor or the anesthesiologist. Due to the shortage of nurses that night, there was just me. I had nobody to come in and help me. I could not pull anyone from anywhere else. So I had to make a quick decision. Luckily, I worked at a teaching hospital. I was able to bring in some nursing students with me. They were my circulating nurse, and I was the scrub nurse for the procedure. Even though I was in there by myself working to get this baby out safely, and everything did come out okay, the other nurses that were out on the floor were still coming to the door saying this problem was going on or that problem was going on, and I would still have to wear the charge nurse hat along with the scrub nurse hat and try and figure things out. I didn't get out of there until about 1 o'clock in the morning after it was all said and done, and I was off the next day. When I went to go pick up my son, who was at my parents' house, and I was talking to my dad, trying to debrief a little bit about what happened, the first words out of my mouth is, I'm never going back there. I can't do this. And my dad, who I get my work ethic from, looked at me and said, if you don't do this, you're going to put the other nurses in the same position that you were in, which is shorthanded. And as much as I didn't want to believe him or listen to him, he was right. And I'm glad I did listen to him, because when I went back to work the following day, I was approached by several different people with compliments of how well I ran a very out of control department that night, and even though things could have been a whole lot worse, everything came out okay, and nothing bad happened. It made me feel good. It made me step back and see that I can work in very stressful situations, and that I actually did do better than I thought I was doing, and it just allowed me to take that experience for the next time that we had a very busy night. Thank you.